Assalamu alaikum. Hi. Today we're going to talk about back pain. So, what is low back pain? Low back pain is pain and discomfort localized below the costal margin and above the inferior gluteal fold with or without leg pain. Okay, or pain that occurs posteriorly in the region between low rib margin and proximal thigh. The most common form of low back pain is the one that is called non-specific low back pain and is defined as low back pain not attributed to recognizable non-specific pathology. So in the previous year, I had this type of low back pain, which was acute and it was not specific. I didn't did any heavy lifting or had an abnormal posture or even I didn't did any severe exercises. So I got this type of pain and I only did a few traction exercises for about 30 minutes. And I was amazed that it worked. And as suddenly I got the onset of pain occurred, the more suddenly after I did the exercises, and as I was doing the exercises, I was feeling relief. And as suddenly that it occurred, just like that, as suddenly it got better. I recovered, and I was able to, even move downwards and backwards easily. I could bend my back easily, and I was amazed by myself because you don't get a lot of self experiences, in this field, and if you do, you don't share it. I never heard from my teachers or my colleagues they ever expressed such a incident about themselves. But I was fortunate because I got to treat myself from this type of specific pain. So as we move forward, up to 23% of the world's adults suffer from the chronic low back pain. Reoccurrence rate is 24 to 80%, meaning it has a high chance of reoccurring again if we are not cautious about it. And the prevalence rate is as high as 84% in the adult population. Okay, so what are the types of low back pain? The low back pain has three types: acute, subacute, and chronic. So acute pain is episodic pain that lasts for less than 6 weeks, and which is a lot of days. And I think that it shouldn't last that much. But the beauty of this type of pain is that even though you are in pain, you can still do some work in the limited range of motion you have. I have seen people that even with acute low back pain, they could do still they could manage doing their work even in pain. So the threshold of bearing the pain varies in person to person. Okay, and then we have subacute pain, which also has a huge time period, 6 weeks to 12 weeks, and then we have chronic low back pain, which is basically pain that proceeds for 3 months or more than 3 months. Okay, so there we have the types, and now we have the structures that are involved in causing low back pain. We have first picture of lumbar spine, and here you can see the lumbar vertebrae from L1 to L5. Yes, there are five lumbar vertebrae, and in this picture you can see their diagrammatical view. The first big picture shows its lateral view, the second one shows the anterior view, and the third one shows the posterior view. And there in the small four diagrams, you can see that the first pic is the lumbar vertebrae anterior view, the second one is posterior view, the third one is lateral view, and the fourth one is superior. Then we have the muscles of the lumbar region and rectospinae, interspinals, intertransversi, latissimus dorsi, rotators, and serratus anterior inferior. These are the muscles located in the lumbar region. And what is the diagnosis? How do we diagnose that a person has low back pain without any pathology and without any radiculopathy, meaning nerve compression or nerve damage? Okay, first we have the physical examination where the doctors inspect. They inspect the lumbar spine by palpating it, by visually seeing it, by measuring and inspecting for any lordosis, increased lumbar curvature, kyphosis, increased thoracic curvature, or sclerosis, lateral increased curvature in the in the whole spine, because scoliosis can occur anywhere in the spine. And they also see that is the scapular margins equal. So these are all the inspections, and then they palpate. They palpate for abnormality or malposition of the vertebrae, or palpate for which area has more pain than the other area. And then we have some tests and neurological exams. Other than physical examinations, we have electromyography and we have X-ray imaging. Okay. low back pain examination. So what does the doctor basically does in the examination is that he assesses central sensitization of the patient and sees either the symptoms are positive or negative. So if the symptoms are positive, if a person has low back pain and it's acute, then the doctor will basically be hyperalgazing the patient, meaning he would uh, be increasing his sensitivity to the feeling of pain. So first is basically provocating pain, and the purpose of the test is that. And the second purpose of the examination is basically checking if there is any denervation, meaning nerve damage, and peripheral nerve sensitization. He will be also assessing the peripheral nerve sensitization, the somatic referred pain, which is from basically the intervertebral disc or the facet joints, meaning is there any bone or disc pathology or pain or problem that is causing any somatic level pain, referred pain. And then we have leg pain, and the doctor will also assess if that pain is radiating to the leg is either due to nerve causes or due to muscular pain or etc. So a few physical exams I have explained via pics, and there's a brief information about them. And I'm just briefly going to talk about these major exams that doctors, usually they do. Other than these exams, there are some special tests that the doctors also use, but they use those tests in patients in which symptoms are not well differentiated with the help of these tests. So that's why specific tests are present. If these tests do not help the doctor in understanding or diagnosing the condition of the patient, then the specific special tests are done by the doctor on the patient to assess pathologies or problems which lead to low back pain. Okay, so the first test is tripod sign. In the tripod sign, as you can see in the picture, the patient is basically sitting and then he leans backwards with his arms basically grasping the couch. And what you can see is that he is basically extending the leg. And what this test does is that a provocation test, and the patient will experience some pain and he will have difficulty in holding this position. The other one test is slumps test, and as you can see from the diagram, the patient is asked to again raise his leg and bend his head. And what this will do is that assess the lumbar spine for any dyscongenic pathology. Then we have straight leg raise, which is the most common used test for assessing lumbar spine and low back pain. And this test basically helps us identifying is there any sciatic nerve involvement, lumbar disc problem, or hamstring tightness. So basically, the person is fine, and the doctors ask him to simply raise his leg. And the other test is Bragard's test, and it's similar to straight leg raise, with only difference is that the patient is asked to dorsiflex his foot, and the findings are to be the same because the test is similar to straight leg raise. So we will also assess sciatic nerve and disc problems and hamstring tightness. Then we have Yeoman's test. Now the thing about femoral nerve stretch test and Yeoman's test is that basically they have the same procedures. So I just basically I myself, take them as one. So what this test does is that is help. It's basically used for lumbar spine, and you test the problems in the lumbar and sacral region. The patient is prone, and one hand of the therapist or the doctor is placed upon the sacrolumbar joint, and the other hand is used to extend the hip while the knee is flexed 90 degree. And then we have the Bonnet's test, which is for hip and spine, and it is used for testing piriformis syndrome. Okay, and how to do is that the patient is spine and the lower leg is raised, and what the therapist does is that he basically internal rotates the hip, and if this rules out any type of pathology or any type of pain, then that means there is involvement of piriformis syndrome, meaning sciatic nerve compression in the patient. Then we have Lesegue test. Lesegue test is for lumbar spine, which is for also sciatic nerve or lumbar disc problem or hamstring. Person is spine, hip is flexed, knee is flexed, and the patient knee is passively extended by the physical therapist. First, what this will do is it will assess for any radicular symptoms, meaning nerve symptoms, if present. The special tests are hip drop, Faber, Fadir, scrap test, Thomas test, Ailey's test, Tendelberg sign, leg length discrepancy, femoro, acetabular joint, external rotation with anterior glide, internal rotation with posterior glide. Okay, then we have causes. The causes for acute low back pain are simply muscle spasm, overuse or overactivity, heavy lifting, heavy weightlifting, fever, malnutrition, obesity, sedentary lifestyle, abnormal position, stress, disc bulge, and pregnancy. Chronic causes, which are for a longer time period, these includes disc bulge that progress into disc protrusion or disc herniation, arthritis, spondylitis, and ankylosing spondylitis. Ankylosing spondylitis is a very severe inflammatory disease that causes the fusioning of bones in spine. And what it does is that it basically causes hyperalgesia to such an extent uh, that the person limits its range of motion and doesn't move the area at all. In my internship days, I got to meet a patient who was about to undergo surgery for this disease. And the irony was that he was not aware that he has such a disease until it was this disease was in its last stage, meaning it became so severe that he was ignoring the pain, he was ignoring the signs and symptoms, he was not going to any doctor. And what happened was that this disease got to such a severe state that the spine basically fused, and the nerves they were compressed, and this person was in hyper. He was in so much severe pain he couldn't even his knees were basically flexed, and I couldn't even do range of motion. I couldn't even help him extend his knees because he was basically crying out and telling me that please don't extend my knees. I'm in huge pain if you even touch my knees, because of the fear of it that I might extend his knee for him. He basically was telling me not to do it. Such a painful disease. So next we have osteoporosis, kidney or bladder infection, spondylolisthesis, and we have spinal stenosis, we have spondylolysis, we have cauda equina, and we have fibromyalgia. So, what are the risk factors? Risk factors are age, lack of exercise, excessive weight, disease, improper lifting, psychological conditions like depression, anxiety, and smoking. So, when to see a doctor? If pain lasts longer than a few weeks, if pain causes weakness, numbness, or tingling in one or both legs, if pain is severe and doesn't improve with rest, if pain spreads down on one or both legs, especially if pain goes below the knee, if pain is paired with unexpected weight loss. So these are um, conditions when you have to go and see the doctor. Other than that, we have medications. The medications prescribed to such a patient is NSAIDs, opioids, local anesthetic, and some doctors sometimes prescribes pregabalin, multivitamin, calcium tablets. Okay, so what's the treatment? The treatment is basically medication, and other than that, it's just rest. It's nothing more than that. So, but if the pain doesn't go away, then you have medication and physical therapy. You can go to a physical therapist and he can evaluate you, he can assess you and educate you and guide you and improve your condition literally because the pain that you are experiencing can be limited by just going to a physical therapy doctor and just meaning you can just take 1 2 sessions of physical therapy. You will be educated and you will become able to manage your condition yourself with just 1 2 sessions of physical therapy. You might be able to help yourself and not limit your activities even when you have this pain. You can still be able to manage your activity of daily living. You can still do that. So I think awareness is what's most needed with diseases, problem, and conditions like this. So I hope this video was of some help, and thank you.